Welcome. Today we'll be simplifying the Frank Starling law and the cardiac function curves. Frank Starling law states that the amount of passive tension in the muscle determines the force of contraction. So the maximum stretch in the ventricle will result in greater force of contraction, which in turn leads to higher stroke volume and cardiac output. To further simplify it, let's take the analogy of blowing air inside a balloon. To blow it up to an optimum size, the amount of stretch in the balloon is directly proportional to the amount of air inside the balloon. So our preload is directly proportional to end diastolic volume. Now coming back to our balloon, if you continue to fill it with air after it has reached its optimum size, the balloon will burst. So likewise, if you continue to stretch the cardiac muscle beyond its optimal length, the force of contraction will reduce and the stroke volume will fall. So let's visualize and plot this in a graph. We have our stroke volume on the y-axis and our preload on the x-axis. And here are our systolic performance and the diastolic curves. Now if we drop a line perpendicularly from the peak systolic performance, this length here is the optimal length or the optimum end diastolic volume for maximum systolic performance. Now let's put this all in a clinical situation. So you have a patient, Mr. J, who's 50 years old and he complains of shortness of breath, generalized tiredness, difficulty falling asleep, and he gets out of breath on mild physical exertion. And he also notices a slight swelling in his ankles. Now, there are so many types of drugs available in the market for a failing heart. Which drug to prescribe? We know that the performance depends on preload and contractility. So you first send the patient for an echocardiogram, and scenario 1 is that he comes back with an increased end diastolic volume. So that implies that there is a problem in the preload and you need to reduce the preload or the venous return. So you will prescribe vasodilators and ACE inhibitors. Scenario 2 is that he comes back with a decreased end diastolic volume. Now you need to increase the preload, increase the venous return, which you can do by giving albumin infusion and giving vasoconstrictors, because constriction of the veins will result in milking of the blood back to the heart. Now there is a third scenario when the end diastolic volume is within the normal range. That implies that the issue is with the contractility. Now contractility can be measured by calculating the ejection fraction. And the formula for ejection fraction is stroke volume divided by end diastolic volume. For a healthy heart, it is usually 2/3 of stroke volume or 66% of stroke volume. And the other way for calculating contractility is by plotting the DPDT graph, that is pressure time graph. Now this is a slightly invasive procedure and it involves snaking a catheter into the ventricle through the femoral artery. And you plot your pressure on y-axis against time. And you calculate the slope of the curve and compare it with the normal curve. And out here we see that the patient's slope is lower than the normal slope. So in this case, we'll prescribe digoxin. Now this here is our cardiac cell and it has a sodium-potassium pump and a sodium-calcium exchanger. So digoxin blocks this sodium-potassium pump. So the level of sodium will increase in the cell. So that implies that the passive influx with sodium-calcium exchanger will be reduced, leading to an increase in calcium inside the cell, and more calcium is available for increasing the contractility. So if you have understood these concepts, you should be able to answer this very simple MCQ. A drug which has a positive inotropic effect on the heart. Which of the following is not expected? Here are your options and this here is your graph. Please pause and try to answer the video. If we look at our slope of the red curve, it is steeper as compared to the normal curve. So that implies that the rate of pressure development has increased as well as the rate of relaxation. So option A and C are happening. Definitely the peak ventricular pressure has increased, so option B is also correct. Option D is our correct answer. And let's look at the systolic interval. Systolic interval, if you mark your systole here, the systolic interval is actually reduced. The implication of this is that the duration of oxygen demand is also reduced. Heart is spending more time in diastole and the coronary flow is maximal. So the contractility is directly related to systolic interval. Now finally, let's look at our cardiac function curves where we plot systolic performance against the ventricular preload. Now cardiac function curve looks at all the factors that affect the performance, but I don't see contractility here. So we make an assumption that all points on the same curve have the same contractility. However, if we move from point N to point C and draw another contractility curve, we see that at point C, our systolic performance has increased, preload is same. So that implies that the contractility is increased. So curves on the left imply increased contractility, curves on the right imply decreased contractility. Now let's draw a cardiac function curve as a consequence of hemorrhage. So from N, due to blood loss, there will be a decrease in preload. Your vector will move to point P. Now the heart will try to compensate by increasing the contractility. So the vector will move from P to Q. And then when you give IV infusions, the preload will once again increase and the heart performance will return to point N. I hope this video was helpful. Thank you.